Right, so this is a very great question. So there are several different special populations in headache medicine, and I should point out that we don't have an official definition of special populations in headache medicine. So this course has been something that has been going on for the last 2 years, but I actually proposed a definition using a framework of other special populations in different entities, like for instance, special populations that in the CMS, so Center for Medicare Services, what do they consider special populations? What does the Agency for Healthcare Research and Quality, what do they consider? Even going so far as to education. So I think it's really important to make that fact that we don't have an official definition. However, using that framework, we framed one. So my definition, and if it's okay, I will read it verbatim. So it's populations in the United States with headache disease who experience increased barriers to healthcare equity in their care or outcomes of their headache disease compared to general populations, and or experience health disparities in headache disease and or underrepresented in headache disease research. And so I say this is a working definition because, again, just using that framework, and I love, for us all to have input in the medical community, how realistic is this definition? And we also need studies as well. And these are, again, proposed groups based on the framework that we came up with. So there are a lot of groups, and we couldn't cover all the groups, but these are groups for consideration in headache medicine. So African American, American Indian, Alaskan Natives, Asian American, Native Hawaiian, Pacific Islanders, children, elderly, homeless, immigrants, incarcerated individuals, maybe, individuals with severe cognitive and mental disorders, individuals with special or unique comorbidities, Latinx or Hispanics, LGBTQ, low income, low socioeconomic, even men, maybe. I have question marks for that because a lot of times the studies don't include a lot of men, all right? So it's a question on that. Non-English speaking here in the United States, pregnant women, refugees, rural populations, uninsured and underinsured, and veterans. So just to name a few that may be really, that should be considered at least as special populations in headache medicine.